Again, a good day, my dear postgraduate students. I had given you a specimen for a homework. The history runs like this. An 8-year-old boy, see the age, with delayed milestones. Look at the presentation. Was brought to the emergency unit. So there are 3 clues that are given over here. And I hope that we had seen a kind of a specimen. One, it is a solid organ. Second, it has got a mildly rainiform shape. Fine. So what can be the differentials? The cut surface, a lot of hemorrhage is there. Therefore, the other details, it is quite justifiable. But the external surface, I am finding multiple pale areas. Multiple pale areas. And then there is a dark, almost a slate gray or a dusky color specific for the organ. I hope we have made the diagnosis of the organ at least. Welcome to the 8th class of Glide the Slide. That's for PGs. So we had seen this. Obviously, a histology will be mandatory. And when a slide is taken, this is what we are seeing. I think you people can comment on the organ at least, leave alone the lesion. I am finding multiple small dark round cells and maybe some larger cells over here. There are also some spaces that I can see, which are being filled with blood. So my diagnosis or your diagnosis can be good. The spleen. And I would like you people to again appreciate what is there in the slide. Are all the RBCs normal, or is there any other form of degeneration or a change or an inclusion or a tumor? I think you would have made the diagnosis. So it is. Anyway, as I told you earlier, there has been infarction in the spleen. This is a fantastic list of diagnoses given by Harvard Medical School and Birmingham Women's Hospital. I never try to camouflage them. It is a superb work. Kindly go back to them. It is worth. We can plead them for information. Courtesy Harvard Medical School and Birmingham Women's Hospital. The condition is whenever there is going to be a coagulation, hypercoagulability, embolization. Sometimes there can be showers of emboli that is leading to repeated infarcts. Fibrillation, infective endocarditis, etc. can lead to emboli. Trauma, of course, can lead to a localized embolus. Myeloproliferative neoplasm. Lymphoma is again one of the classical things we should think of. Gaucher's disease. There can be a huge spleen, but I'm not finding some cells like the Gaucher's cells. Hemoglobinopathy, sickle cell disease. Vasculitis or torsion can always be there. But in these conditions, there can be a total infarct in the torsion. So this I put up mainly for your list of diagnoses to support your theoretical knowledge. Going back to the slide. It is the same slide. Can we identify something of it? Good. You have made the diagnosis. It is amazing that nearly about 720 students have messaged me the correct answer. So I am finding cells which are elongated. And then they are plugging the sinusoidal spaces, preventing further flow of blood. So it is a case of sickle cell anemia. If you are not convinced, look at this. Look at the elongated cells. So Sometimes hematological diagnosis will be given to us in histopathology. There are a good number of examples. We shall be seeing them in future. So there is a clog and some of the cells are elongated, not many WBCs. So the diagnosis is a sickle cell anemia. I would like you to kindly correlate this with the next one. Generally, when we see something like this, we do ask for the peripheral smear. And a peripheral smear will be showing definitely sickle cells. So even if there is a doubt, there can be a sickling test that can be done. And these are my sources of references. R.A.T.S, my class, one page my book, Tejinder, an authority, and Roberts. A good list. Here again, I am seeing a nucleated RBC. Some of the cells are large, so they are the polychromatic cells or the reticulocytes. So this is fantastic over here. I am able to see the sickle cells very clearly, and they have pointed it out with the arrow. Now, another additional question for our knowledge, so that, as I told you, the slide should take us to the what are the crises we can see? One is a sickle cell crisis. There can be an occlusion, particularly the sinusoids. One. Secondly, if it is going to be within the bone, you find that there can be something like a carpal tunnel syndrome because of the sequestration. Third, there can be recurrent infections. Four, there will be repeated infarcts, which is leading to a condition called as autosplenectomy. And finally, there can be a burnt out syndrome or an aplasia. Your books on hematology will be giving it, and this is not an uncommon question for us, both in theory and in Bible. So this is a brain tease. Here again, I am finding a huge spleen with multiple pale areas, and my question straight away is, what is a geographic infarct? I shall give you the answer for this at a later date because I would like you people to kindly discuss and come to a diagnosis. What is a geographic infarct? This is the slide for the next session. Lesion from a 4-year-old child. Do your homework, ask your faculty and friends, come to a diagnosis, go to the book, study, and come back to my class. Thank you.